Hi guys, I'm gonna let it go for a couple of minutes just for people to sign in. Thanks for coming. Just a few more seconds. I always say a couple of minutes, but I don't ever mean it. Alrighty. So good evening, everyone. Can you hear me okay? Thumbs up, maybe. Alyssa, Noah, okay, thank you. Um, so thanks for joining us tonight. I'm just feedback, that's all. My name's Danielle Angelari, and I'm the Executive Director of NAMI Northern Illinois. And for those of you who are unfamiliar with our organization, we're an affiliate of the National Alliance on Mental Illness and the nation's largest grassroots organization dedicated to improving lives of individuals and families living with mental illness. Our group specifically serves Winnebago, Boone, and the surrounding counties in our region. Though we do not offer clinical services, we listen, we support those in need through various peer-led groups, we educate families in our community, we advocate by helping to shape public policy and programming for people with mental illness and their families. We lead many awareness events and actively fight stigma, encourage understanding, and keep in the forefront of everyone's mind the importance of mental health care. We also provide the tools and resources necessary to improve response to mental illness for all. To begin tonight, I just wanted to share a few updates with everyone. As our community continues to change its COVID-19 protocols, our support group locations continue to change. For adults living with mental illness, we offer 2 weekly groups on Sundays and Fridays. For teens and young adults with mental illness, we offer 2 groups a month for each. And for families, we have 3 support groups for adults with adult loved ones and 2 that meet throughout the month for parents and caregivers of children. Many of our meetings are back in person, but a few remain virtual. Please provide your email below and I will send an updated schedule your way if you're interested. We are in search of additional support group leaders with a peer's perspective and other types of volunteers, so please let me know if you're interested in something of that nature. We have begun planning our annual Mulligans for Mental Illness Golf Play Day, so stay tuned for more information about that as well. And one last thing, we do have another community education program like this tomorrow at 5:30 for an introduction to the new pilot program in Rockford, the Crisis Co-Response Team, who is a joint unit of mental health professionals and first responding officers. You can pre-register for this on our website, and I can also put it in the chat box after I'm done with my little spiel. Tonight we have Alyssa Maggio, who is a drug overdose prevention training specialist, and Noah Mesa, who is a drug overdose prevention deployment specialist, both from the Winnebago County Health Department, here to speak to us about opioid use disorder and to train us in using naloxone. Opioids are both natural and man-made chemicals that interact with opioid receptors on the nerve cells in the body and brain and reduce feelings of pain. They're a class of drugs that include prescription pain relievers, synthetic opioids, and heroin. Opioids can reduce the perception of pain, but can also cause drowsiness, mental confusion, euphoria, nausea, and constipation. At high doses, they can depress respiration. Opioids produce high levels of positive reinforcement, increasing the odds that people will continue to use them despite negative consequences. Opioid use disorder is a chronic lifelong disorder with serious potential consequences, including disability, relapses, and death. Naloxone, on the other hand, is a potentially life-saving medication used to quickly reverse an opioid overdose. It can reverse and block the effects of other opioids and return normal breathing to someone whose breathing has slowed. You should have received 2 documents from me, and if you didn't, I'm happy to resend them again. The presenters will need them tonight or tomorrow after the presentation's over with. They will be reaching out to you via email. And if you have any questions for Alyssa or Noah, please type them in the chat or question and answer box, and I will facilitate them at the end of our talk this evening. Again, thank you for coming, and I will hand it over to them.
Hi, as Danielle stated, my name is Alyssa. I am with the Winnebago County Health Department. I am going to be working on bigger community organizations and community members, such as like NAMI, and then my coworker Noah will be working on shorter trainings within the community. So welcome to the Naloxone training provided by Winnebago County Health Department and the Drug Overdose Prevention Partners. This training will cover information about opioid use disorders and the opioid epidemic in the US and within Winnebago County. Through information provided along with several videos, by the end of this training, you will know a little more about opioids, how opioid use works on the brain, how overuse can put people at risk of an overdose, which could cause death, and how to use naloxone to reverse a drug overdose to save a life. Opioids are chemicals that are produced either naturally, which is directly made from the poppy seed of opium plants, or through the production of synthetic versions of that natural chemical. Opioids are used to reduce severe physical pain experienced by surgery, injury, or chronic illness, or chronic pain or terminal illness. Opioids can lead to addiction if someone uses regularly without a prescription or a doctor to monitor the level of the drug within their body. The more people that use, the more the person uses an opioid, the more the person's body gets used to having that drug in their system, which then it will not help the pain as it once did, which causes a person to use more of that drug in order to get the same feeling that they had when they first used the opioid. Someone who uses it every day to feel normal is dependent on that drug and will experience withdrawal symptoms if they stop using. Categories of opioids range from natural to semi-synthetic to synthetic, which means it has no natural component left in the development of the drug. Medications such as oxycodone, which is Oxycontin, and hydrocodone, Norco, or Vicodin have become familiar medications for people who have had surgery. Even having your wisdom teeth pulled, patients often receive pain medication such as hydrocodone, which is called Norco. Fentanyl was developed to help cancer patients with pain management. With each category, there's a risk of dependence and addiction to that drug. 1 in 4 patients receiving long-term opioid therapy in a primary care setting struggle with opioid addiction. This video illustrates how opioids impact your brain and how addiction to a drug, whether it's alcohol, cocaine, or opioid, develops over time. Danielle, you might have to enable the content. I don't know if it says anything.
It does not. Is it something I can pull up on YouTube for you?
Yeah, I can do it though. 1 second.
Okay.
This is the canoe that a young couple will get gloriously lost in together.
This is Susan. Susan loves to bike. While out for a ride, she falls and breaks her arm. Special cells called neurons send a signal through the spinal cord to the brain, which interprets the signal as pain. Susan understands the pain means she needs to go to the hospital, and her body is equipped for survival, helping her not to panic so she can seek help. Many of her neurons are covered in proteins called opioid receptors. These receptors act like a brake to slow down the neuron's ability to send pain signals. When injured, her body releases natural painkillers called endorphins. Like a key in a lock, endorphins activate opioid receptors, slowing down the pain signal and preventing a panic. Susan gets treated for the broken bone, but 3 months later, her arm still hurts. And now that pain is making her feel depressed and anxious. So her doctor prescribes an opioid painkiller. There are many different opioids, but they all share a chemical similarity to our own endorphins. This allows them to bind to the same opioid receptors and stop pain signals. But that's not all they do. Deep inside Susan's brain is a region called the ventral tegmental area, or VTA for short. The VTA is full of neurons that produce a chemical called dopamine. When something good happens, dopamine is released, giving Susan a feeling of pleasure. This helps teach her brain to keep seeking out good things. To keep dopamine neurons in check, inhibitory neurons keep the brakes on until something good comes along. Just like the pain neuron, these neurons are covered in opioid receptors. When Susan takes the painkiller prescribed by her doctor, the opioid receptors turn off the inhibitory neurons and release the brake on the dopamine neurons. The rush of dopamine temporarily eliminates Susan's depression and anxiety, and she feels relief, calmness, and even euphoria. As Susan continues to take the painkillers, her brain responds by trying to regain its balance. Her inhibitory neurons work extra hard, even when the opioid receptors are activated, and it becomes harder and harder for her dopamine neurons to release dopamine. Susan finds that she needs to increase her dose of painkillers in order to feel comfortable. This is called tolerance. Eventually, Susan's pills run out. Inhibitory neurons that had been working overtime are let loose, clamping down on those dopamine neurons and shutting them off almost completely. Now, not only is Susan in pain, but the depression and anxiety come back. On top of that, Susan feels ravaged by an inescapable physical sickness far worse than any flu. Susan's body is going through withdrawal. Most people who take opioids for a long time tend to experience some withdrawal, but they can still stop taking the pills and return to normal. But for people like Susan, it's not so easy. Her genetics and the environment she grew up in put her at a higher risk for addiction. Her withdrawal symptoms aren't just unpleasant, they're unbearable. Susan thinks the only way to feel normal is to find more opioids. And this is how the cycle of opioid addiction emerges, driven by a brain trying to regain its balance. But there is hope for Susan. Though the road to recovery can be challenging and there may be setbacks, treatments can retrain Susan's brain. With the help of medication and therapy, Susan finds pleasure in her life once again.
Fentanyl is a synthetic opioid pain reliever that is prescribed for treating severe pain, typically for advanced cancer pain Fentanyl is 50 to 100 times more potent than morphine. It is involved in at least 70% of deaths in 2018. Some areas of the country have reported close to 80% of opioid deaths as a result of fentanyl contaminating the product. Illegal drug use causes the highest number of overdose deaths. Often fentanyl is mixed with other drugs to increase drug effects. Most commonly it is in drugs that are sold as heroin, but it also can be found in pills sold as Oxycontin and benzodiazepines like Xanax and cocaine. People who use drugs are unaware of the addition of the fentanyl to the drug that they are purchasing. Therefore, not knowing what and how much fentanyl has been added to the product they have purchased can put the person at risk for a drug overdose within minutes of injecting, snorting, swallowing, or inhaling the drug. As you can see in that picture, a very small amount of fentanyl compared to heroin can be lethal and cause you to overdose. Nationally, in 2018, the total number of deaths for drug overdose was 67,367. Of these total deaths, opioids were involved with 69.5% of the drug overdose deaths. Opioids such as fentanyl were most often the cause of drug overdose death. Recent statistics from Illinois indicate that overdose deaths have increased in 2020. It is estimated that over 3,000 deaths occurred in Illinois in 2020, a 50% increase since 2018. Rates of overdose deaths started increasing in 2018 and have been on the climb since. As I stated, synthetic drugs are the most primary driver of OD, which is things such as fentanyl. Winnebago County continues to see a higher rate of overdose deaths than most other counties in Illinois. As you can see in that picture, for the non-fatal overdoses, but also fatal, I highlighted Winnebago County and it's the dark blue color. That is the highest color that you could get on that map. In 2019, Winnebago County saw more drug overdose deaths than Cook County did. According to the Winnebago County coroner, in 2018, the majority of drug overdose deaths were males between the ages of 40 to 59. They're often also associated with white males, but it is also increasing to Hispanic, Black, and not communities as of national statistics. Heroin and fentanyl, the opioids most commonly involved in overdose deaths, but using prescription opioids, whether they obtained from a legal prescription or obtained on the street, can also result in an overdose. The following factors increase an opioid user's chance of taking in too much of the drug and overdosing. People who have been recently detoxed from the drug due to incarceration or treatment programs have been released from a treatment program or jail. So this is because they often try to use the same amount that they were using before they went into program or into the jail, and their body cannot take that anymore, which causes them to overdose. Mixing opioids with other drugs, including alcohol or other prescription medications. Self-medicating by increasing dosage that is not prescribed by a doctor. Switching between opioids. People who are discharged from a hospital emergency room after an opioid overdose. People who use drugs not knowing the level of fentanyl in the drug they have purchased. People who have chronic medical conditions such as HIV, depression, arthritis, cancer, or any disease that requires long-term use of opioids in high doses, which can increase your chance of addiction and potential overdose. And then using alone is one of the biggest problems. So we do not condone using. However, if somebody is going to use, you don't ever want them to use alone, because obviously that exponentially increases their chance of dying and overdosing rather than being able to be saved. So I'm going to pass it on to Noah for a second.
All right. Hey guys, again, my name is Noah. If you didn't catch that earlier, hope you're doing well today. So now we're going to talk a little bit about recognizing an overdose and how to recognize it. It is important that, that you understand that an overdose can happen anywhere. People sometimes think that most overdoses just occur in a house. That might be true, but people have been found everywhere. If that's from a work bathroom, a parking lot of a restaurant, inside the restaurant bathroom, etc. The list goes on and on. So it's important as a bystander to be ready to recognize, these signs of an overdose, so you know what to do and you can take action and really help prevent a fatal overdose. So one of the most common ways is by looking at their lips and fingertips. If you recognize that they're a little blue or purple, this is a great indication that, an overdose is occurring. Another great one is, of course, if the individual's unresponsive, if you kind of give like a little shout like, hey, and then you proceed to give them a sternal rub in the chest with your knuckles, it'll be displayed in the video later. If you're not kind of sure what the sternal rub is, stay tuned. Also is small pinpoint pupils. So if their pupils are very small, a slower, irregular breathing is a big sign of an overdose, because overdoses cause people to stop breathing. Ultimately, if they have a slow heartbeat or blood pressure, and if they're palm and clammy skin. So if they're looking kind of pale, that's a great indication. So if they have a couple of these, you can kind of recognize, okay, maybe this person is overdosing. And so after you've recognized an overdose, it's important to know what steps to take. So first, you recognize the overdose, okay? The next thing you should do is immediately call 911 and stay with the individual. It's important to not leave them. And we'll talk a little bit about the Good Samaritan law later, but this allows you to not get in trouble if you're staying with somebody overdosed, even if you're with them while they're overdosing. After you've called 911 and you made sure you're there, it's very important to administer the first dose of Narcan and then to monitor their breathing. And if after around 2 minutes you don't see that they start breathing again, you should definitely administer a second dose of Narcan. And then if no breathing proceeds after that, if you know how to do chest compression rescue breathing, that is very important to do. And then after that, if they do start breathing again, place them in the recovery position, which is on their side. If you're not sure what the recovery position is, it'll be displayed later in the video. So stay tuned for that again. And then after that, it's very important to remain with them until the ambulance gets there. So like I touched on earlier a little bit, well, one slide previous to this, if you're not familiar with the Good Samaritan law, the Good Samaritan law took effect January 1st, 2012. The Good Samaritan law basically was made to encourage people who are using with other individuals and who are bystanders with the individual who's overdosing to be a positive bystander in the overdose process and intervene so it doesn't end up being a fatal overdose. Basically, in short, if a person calls 911 or takes somebody to the emergency room for an overdose or following up with that, both people seeking the emergency help and the person who overdosed, so basically the person who overdosed and the people who are with them, will be protected for being charged with a felony possession of less than 3 grams of heroin, less than 3 grams of morphine, less than 40 grams of prescription opioids, and less than 6 grams of other drugs. If you do have a warrant out for your arrest, however, and or if you are a seller / distributor of the drug of illegal opioid, you will be charged with drug-induced homicide. If you're a distributor, if you have a warrant out for your arrest, you probably will still get charged, but not for, not severely for the possession, if that makes sense. If you have any questions, feel free to ask them. So some relevant laws that will, am I one slide ahead? Let's see.
I got it. So I'm going to have to go to the internet again to do this video. So 1 second.
I think you skipped some slides. It's okay. We could just watch the video first. We'll go back since you're already on the internet.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Indications. Narcan, naloxone hydrochloride nasal spray, is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose, as manifested by respiratory and/or central nervous system depression. Narcan nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. Narcan nasal spray is not a substitute for emergency medical care. Important safety information. Narcan nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping the patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonists. Reversal of respiratory depression caused by partial agonists or mixed agonists-antagonists, such as buprenorphine and pentazocine, may be incomplete. Larger or repeat doses may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, diarrhea, increased heart rate, tachycardia, fever, runny nose, sneezing, goosebumps, piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. In neonates, opioid withdrawal may be life-threatening if not recognized and properly treated, and may be characterized by convulsions, excessive crying, and hyperactive reflexes. Monitor for the development of opioid withdrawal. Risk of cardiovascular (CV) effects. Abrupt postoperative reversal of opioid depression may result in adverse CV effects. These events have primarily occurred in patients who had pre-existing CV disorders or received other drugs that may have similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting after use of naloxone hydrochloride. The following adverse reactions were observed in a Narcan nasal spray clinical study: increased blood pressure, musculoskeletal pain, headache, nasal dryness, nasal edema, nasal congestion, and nasal inflammation. See instructions for use and full prescribing information in the use of this product. To report suspected adverse reactions, contact Adapt Pharma Inc. at 1-844-4-NARCAN, 1-844-462-7226, or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.
Okay, some other relevant laws that are relatively important. First, we'll start with the Illinois Drug Overdose Prevention Program law. This basically allows non-medical professionals, and this also includes like community members, family, and friends, to administer naloxone to prevent a fatal overdose. This is very important because this allows us to distribute Narcan to people and allows us to train them so they can be a bystander when it's important too. If you would prefer to use the Emergency Medical Service Access Law, which is the same as the Good Samaritan Law, that's a long name if you feel like using a longer name. If you have any more questions about that, which we talked earlier, feel free to ask questions at the end or email us. And another really important one is the Public Act. This basically makes up some medical doctors that give out prescriptions. Every time they give one out, they have to report it to the Illinois Prescription Monitoring Program. So people cannot obtain the same prescription from different doctors. This is very important. So it kind of restricts people from obtaining more drugs than they need to for a certain condition or injury. So on this slide, we'll talk a little bit about naloxone. If you do not know by now, we'll give you a quick overview of what it is. Naloxone is an opioid receptor antagonist. It works by temporarily reversing the clinical and toxic effects of an opioid overdose. It's very useful because there's no harm with it. If someone uses it and they're not overdosing with an opioid, they might have a little discomfort in their nose, but nothing harmful. There's no abuse factor with it. You can't get high from it. So it's a very safe way to help reduce an overdose if someone is doing that, help them continue breathing. It comes in two forms, the injection form and the nasal form. Luckily, we have the injection form. No, sorry. We have the nasal form to give out, and the nasal one is very portable and easy to use and very simple, comes with instructions, but from the video, you should know how to use it by now. If you have any questions, again, feel free to reach out, but we do have the nasal one available to give out to you all. This is the overdose reversal reporting form. If you do so happen to be a bystander, it would be very much appreciated if within 5 days of you using the Narcan, if you could fill this out and return it to my coworker, Alyssa. This form is very important for us to report the numbers to the state so we can not only continue doing this program, but so we can show that we're making a difference in what we're doing. So if you ever, or anybody you know who received Narcan from the Winnebago County Health Department or one of our partners uses it, it would be greatly appreciated if you could fill this form out and email it back to my coworker. You will get this form at the end emailed to you, hopefully, or you have it by now. If not, feel free to contact us. Finally, this training and the free Narcan kit, if you choose to get one or two per person, is provided by the State of Illinois Department of Human Services, the Winnebago County Health Department, along with all of our partners below. We all work very hard to help fight this epidemic. And if you have any questions about any of our partners listed below, feel free to contact us. We have great information on all of them, and they all do great things. And this is our contact information. Again, I know I said this many times. If you have any questions after this, I know we might answer some questions right now if you do have them, but if you need any help with anything, or if you want to get in contact with us about other people's trainings or really anything, here's all our contact information. Feel free to reach out to us.
Thank you, guys. We appreciate it a lot.
Oh, no problem. Thank you for
I just want to open it up to the attendees here tonight. If you have any questions, feel free to type them into the chat or the question and answer box, and I'd be happy to read them to our presenters. I'll give you a second. Otherwise, Alyssa, do you want to kind of explain next steps too?
Yeah, sure. So next, the two forms that Danielle previously sent to you were the training checklist, which just states that you understand everything that we went through on this training and you understand how to recognize the signs and symptoms and then administer Narcan. And then the other one is a training survey, just talking about today. They're both very short and quick and easy. They're basically check off boxes. I need those returned to me at that email, or if you lose my email, you can always send them to Danielle and she can forward them on to me. But then Danielle, I wasn't sure, would it be easier? Do you think it would be easier to set up for all of them to pick it up, or if it would be easier to grab from you? I don't know if it's easier that way, if most of them come there or not.
Either is fine. Like, this is open to the community, so it might be people that I don't know either. So
you can either email me to set up a time to pick up your kit, or we also have the capability of dropping it off to you, whatever is easiest, or mail.
Sure. I can provide you, Alyssa, with the email addresses of people that have attended tonight. So just make it easier. All right, I don't see any questions. So again, I appreciate you all both for presenting and attending tonight. Oh, wait. Once surviving overdose, will you be on a prescription to manage your symptoms? I'm not sure I understand that one. I believe it says once surviving an overdose, will you be on a prescription to manage symptoms?
Yes, are you talking about like MAT? Some people go on into MAT programs and some do not. That's just medically assisted treatment. So places that provide that are Remedies and Rosecrance in our county. And there's also private providers, but those two are the largest ones. And some medications that they use is methadone or Suboxone to help to detox off of heroin or fentanyl, any type of opioid to help do that. Not all people do that, but some do.
Okay. And there's another question. Could I get one mailed as I live in Stevenson County? Is that fine
Yeah.
to do? Okay. If we must use the dose, will the Winnebago County Health Department automatically replace it?
Yep. If you use your dose, you just have to provide me with the reversal form, and then you can set up a time to pick up a new kit.
Awesome. Are there any more questions, guys? Okay. If not, I hope you all have a really nice night. Oh, how long before it expires?
So they just created a new batch that they just started distributing in December, and some of ours are 2 years doses still, but the new batch, anything that was bought after December, like the middle of December, is now 3 years for the expiration date.
Okay, awesome. Is there any does it probably doesn't still work then after it's expired? Or
It
just
they still suggest that you use it even if it's expired because it's more likely. It's just like any medication. They just say that its shelf life like slowly deteriorates over time. So if
right,
you antibiotics or anything, they suggest not. It's not going to fully work for you, but it's better than not giving someone that's overdosing.
right. Thank you, Barb. You've gotten several thank you guys on the chat if you have seen them. No. Appreciate you. Have a good night.